Okay, right, we should be on. I'll just check that anyone that's on the other side is pulling through. They should be. I forgot to say, Alan, we won't see anyone else because it's like a presenter view, so it'll just be us. Everyone else will be on the other side of this, just watching. So yeah, welcome everyone. Welcome to another one of our Nexus Fertility events, and this one is all about what men should know about their. Oh, am I on mute or something? Alan said he can't hear me. Kieran, can you hear me?
Yeah, I can hear you, buddy.
Okay. Alan said he can't hear me. I'm not
I
sure
can
what's happened. Oh, okay, brilliant. Perfect. Right. Okay. I will. Yeah. So this event this evening is all about what men should know about their fertility, and as we know, as men who have been through it, there's an awful lot more that we could and should know. So we're delighted to be joined this evening by Professor Allan Pacey. Alan, welcome. And yeah, this is all about just giving what we are passionate about here at Nexus. Oh, you can't hear again. Kieran, he said when you go on mute, you can't hear. So
Yeah, I've just realised, so I'll keep mine
yeah,
off mute.
yeah,
No
okay,
worries.
excellent. So yeah, just I was just saying, Alan, that tonight's all about one of our core themes and values here at Nexus is about cutting through misinformation and the headlines and stuff. And there's been a fair bit in the press recently about male fertility, which is good. It's good to see that it's on the agenda finally. So yeah, we just want to cut through some of that really and get your expert opinion on what is being said. Now, before I get into it, as always with any event, we have a disclaimer here at Nexus, and that is Nexus events are designed to provide objective oversight, balanced information, and general guidance. Nothing shared during these sessions is intended to replace personalized medical advice. Always consult your own healthcare provider with any questions or concerns about your health, fertility treatment, or changes in your condition. So without further ado, yeah, just want to welcome Professor Allan Pacey. Alan, thanks for joining us.
It's a pleasure.
It's a pleasure and honour for us, so thank you. I think I wonder if perhaps you could just give a top level overview. I know this could probably go on for the whole session about who you are and what your background is.
Sure. Well, I go by the name of Allan Pacey, Professor of Andrology. I work at the University of Manchester now. I think when I was made a professor, the Daily Telegraph ran a feature about the fact that I was the first and only Professor of Andrology in the country, maybe the world. And I think that's still the case. So andrology is the science of male reproductive health. And I've been doing that for over 30 years now. So I've probably written, I don't know, 200 papers or so. I've given hundreds and hundreds of lectures. I've done hundreds of things like this. And I worked within that time 17 years in the NHS, where I was in charge of diagnostic laboratories. I ran a sperm bank. I sat on the board of an IVF unit. And I've done lots of things like help with NICE guidance, World Health Organization guidance, and things like that. So a lot of experience in andrology.
Perfect. Couldn't think of anyone better to join us this evening. And yeah, thanks again, Alan. So I guess without further ado, let's get into it and the state of male fertility today. Really, as I mentioned at the outset, I don't know if it's one of the bits you couldn't hear actually, Alan, but there has been an increased presence for male fertility in the press recently, which is good. It's getting that attention it needs, and hopefully it reaches ears who wouldn't necessarily have heard these things previously and start raising that awareness really. So in terms of male fertility, how common is it? And like men are said to account for around half of all fertility cases. Is that the case?
Yeah, so I think the statistics have been really fairly constant over the years. I mean, you're right, it kind of comes in waves in the press, and we're on a bit of a wave at the moment, I think. I always say that about one guy in every kind of football team, about 1 in 12, 1 in 13 guys probably has some kind of fertility problem, but they may not know it at that point in time. and it's kind of a lifetime thing. So I would say, you know, maybe 1 in 12 over the course of their lives may discover that they've got a fertility problem. Now, if you take it into couples, and we have to look at this statistically from the point of view of heterosexual couples, we don't have much data on gay men or single men, and that's not collected in quite the same way. But within couples, it's generally about 1 in 5, 1 in 6 couples, heterosexual couples, have a problem. And in those, about half of the time, there is some kind of male factor infertility. So the burden of infertility is split about 50-50. And that's why we need to talk about it as much as we hear about female infertility and couple infertility.
Absolutely. And yeah, like you mentioned, we do hear a lot more about female infertility, and I think that the numbers of gynecologists compared to urologists or andrologists are a lot higher. But then realistically, when you take a step back and think about it, of course we are 50% of the equation. Why? I don't know why. It seems like a shock. It was a shock to me, you know, when I heard it. But yeah, the stats are there. Like you said, it's going to be someone that we know, that we sit near, or if not ourselves, someone in our family or close friends group. And so yeah, it's
absolutely. But we don't have the narrative about it, and I think that's very, very true. I think historically, male infertility was often used as a comedy vehicle in some circumstances. It's often been linked wrongly with sexual function, where they're completely separate things most of the time. And I've known, you know, couples at barbecues, and the women are inside talking about their infertility troubles, and the men are outside talking about football. So there's an element of men having to step up to this as well and being a bit more open, which is why what you two guys do is really good.
Thank you. Yeah, indeed. That actually, I remember when I started opening up to my work colleagues, and I sat next to a female, and then there was another guy on the other side of her. I confided in her, and she said, "Martin, who's that guy, but one for me. Martin and his wife went through this. Seriously, what do you blokes talk about?" And I said, "Well, not that."
Yeah.
And then
Absolutely.
therein lies the problem. And as soon as I spoke to him about it there, and he was so great with advice, and it wasn't male factor as such, but he's been in the trenches. He got it and gave me some great advice moving forward. And but like you said, it's changing the narrative. Now, like I said about headlines, I was I gave a lived experience comment for a piece in the Daily Mirror maybe a year or so ago. And then when the article came out, I was quite shocked to see the headline. Obviously, it's a red top. The headline they gave it was "Spermageddon." That we're all going into this headlong into this crisis, and talk about this global decline in sperm health and sperm counts, etc. How true is that?
Well, we've been talking in kind of science and medicine circles about this since about the 1950s, believe it or not. It's that old as a debate. I think there are two sides to this argument. There is, on one side of the academic argument, there's some compelling data from what we call meta-analysis. And that's meta-analysis is where you take lots of studies and you kind of collate all the data into a single story, if you like, and you use some fancy statistics. That data suggests that sperm counts have declined and are continuing to decline. But there's another argument which says that actually, hang on, you can't do that. You can't do that and be reliable about the result. And what we need to do is have some forward-looking studies and prospective studies that track men year by year by year by year to see whether things are changing. Now, those studies show there's no decline. These studies show there is a decline. And so that just shows you there's an interesting debate within the scientific and medical literature. No one knows whether it's true. There are two sides of the argument. And so some of these headlines in the newspapers I find a little difficult because they tend to be on the scaremongering side. And I don't think what we should be doing is scaring people. We should be doing proper scientific studies that actually are determined to answer the question. So the jury's out. I hope it's not true. It may be true, but we don't yet have the full burden of proof, in my view. There are professionals who would disagree with me, and that then shows you equally that we're still in that debate kind of equipoise part of the narrative.
Sure. But the most important part of that is that there is a debate and it is on the agenda, I guess.
Yes, yes,
It's
very
no
much
longer
so.
in the shadows. But like you said, we have to be careful, because what we don't want to do is scare men off further from perhaps early testing and just that awareness piece.
Yeah.
So that kind of answers where I was going to go next, but just generally about fertility trends over the recent decades with environmental and lifestyle shifts that we've seen and our kind of the convenience culture we live in. I think that the probably, from my perspective, there seems to be less of a debate in that our modern lifestyles are not conducive with healthy fertility.
Yeah, and I think the one that you've missed out there, which I think is important, is the impact of age. So when you look back through your family, if I look back through my family, fathers of, my father and grandfather were in their early 20s when they first started to have their children. And now we've seen a massive shift in society in that men and women are generally in their 30s when they begin. And that shift of 10 years actually makes a big difference to your fertility prospects. So going back to, the 50s, 40s, 30s of the last century, if you started to try for a family and you were 21 and your partner was of a similar age, then you may have taken a long time, but you may have got there in the end. And I know the village I lived in, there was rumours of, oh, well, they were trying for years, but, after 7, 8, 9 years, they finally got there. Now we don't have the luxury of time if you're starting in your 30s, because we know female fertility declines above the age of 35, male fertility declines above the age of 40. So what we've done in our society is to compress our baby making into a much shorter window. And then if you layer on that our lifestyle, our stress, our working long hours, sexual frequency has declined over the last 3 decades. So we're having less sex than our fathers were, believe it or not, and our grandfathers probably were. And all of those things kind of feed into a kind of infertility paradigm. And junk food only adds to the thing. Lack of exercise only adds to it as well. So we've seen a huge shift over the last 30 years, I would say. I hope we don't see much more of a shift, because it will only serve to compress the problem even more.
And there's certainly some scary figures around the reproduction rates worldwide as well at the moment.
Indeed,
I guess all of that ties in with it. But yeah, really interesting. Thank you. Another hot topic at the moment, certainly it's come up, and I know probably we are in a bit of an echo chamber, but it does seem to be something that has found its way into some more mainstream articles recently, is steroids, and particularly in men and their impact on male fertility. And when I did a bit of research into this prior to this this webinar, I saw a very familiar name, and you've obviously done quite a bit of work on it, because there's the Mossman-Pacey paradox. So if you could please explain a bit about that.
Yeah, I can. That was not by design, the Mossman-Pacey paradox. So we've known for a long time that anabolic steroids that men take when they go to the gym are not good for fertility. I'll tell you why in a moment, but we know that is not good. And one of the classic stories that you would hear when you were in the infertility clinic or talking to the doctors and nurses who'd just been to infertility clinic was, oh my goodness, I saw this couple and this guy was huge, and I broached the topic of anabolic steroids and he wasn't very happy for me to talk about it. So it's a very sensitive issue. Now, why it happens is that if you take injections of testosterone, or indeed you take testosterone through any other route, it's usually an injection or a gel. You can't take it through tablet form at the moment. If you do that, then what it does is it tricks your body to think that your testicles are really producing testosterone, and that stops the hormones in your brain from then triggering the make sperm hormones that they produce, and which are important to signal to the testicles to start making sperm. So you put on lots of muscle, but your testicles become small, they get smaller, they don't produce sperm, and that is a big problem if you're trying for a baby. Now, not This isn't well understood in many circles. So guys kind of go off to the gym to look nice. They don't realize that this is part of the problem. So that's how it happens, and that's how long we've known about it. Now, Jim Mossman was a PhD student of mine, and he was from an evolutionary biology background. He was interested in why some animals were more fertile than others and things like that. And so it's a lot of science there. And he always used to kind of make the connection between these big guys that would come in for a semen analysis and the low sperm count or no sperm count. And it triggered some evolutionary biology thoughts in his head, which was why would men do something to make them look beautiful that might impact on their fertility, when part of the reason for looking beautiful is presumably to try and get a mate. And he wrote this up for a journal, and they loved it. And they wrote an editorial which said, this is very true, but also remember those men that put on hair lotion. There's a hair lotion called finasteride that prevents you from going bald or stops the hair receding. And that has exactly the same effect. It can stop the hormones being produced that leads to that signal the testicles for producing sperm. And it was the journal, not us, that said, let this phenomenon be known as the Mossman-Pacey paradox. And it led to a bit of media activity. It led to a Wikipedia page. And it led to me getting an awful lot of email from bodybuilders saying, how dare you say these things around us, about us. So just, you got to be careful what you say sometimes.
Wow.
But it's important to have that knowledge and have that debate, because if you want to conceive and your testicles aren't working because you've taken anabolic steroids, it can take some years for them to recover. And that's not a good place to be, particularly if your partner is of an age where her fertility is beginning to decline. So it's really important that guys that go to the gym and take this stuff are aware of what they're doing. It's not a good thing to do, in my view.
Sure, yeah. That I was going to come on to that actually. Is there a remedy for this, or is it literally just waiting for those the hormones naturally to kick back in?
Yeah, time is the main remedy. There are a few studies, I think, where they have tried to short circuit it by giving injections of things called gonadotrophins, which are the missing hormones, and that can work. But I think time is the main remedy for this. And of course, if your partner is of an age where her fertility is declining, time isn't what you have.
Absolutely. And I've read a few online accounts actually of people who did perhaps steroids, but just gone on really big kind of personal training journeys to change their physique to try and impress women. And then they say the only people that came up to me were impressed with blokes and were saying, oh mate, what you're lifting and all this, what you're benching. And so and all that time kind of not developing their character and all the other things that can be attractive. So there you go. Indeed. It's not for me to lecture on that one. I've not really ever been a massive gym goer, just to keep healthy really. But so thank you for that. It's certainly, I think, is something that, again, information and awareness is certainly out there. So that's only a good thing, that people can then start to consider things before they might make that jump. And certainly who they're getting it from, I think, as well is important, and where. So in terms of, we know that it's now easier than ever, perhaps, for guys to start testing their sperm with home sperm testing kits, whether it's ones that test at home or perhaps get mailed off or along those lines. So there has been a big rise in those. To your knowledge and experience and research, how reliable are they?
The ones that are on the market now are actually pretty good. And what I mean by that are the ones that are kind of attached to your mobile phone, where you can kind of clip on a little device and you produce the sample at home and your mobile phone does the test. Spoiler alert, spoiler alert, conflict of interest. I have advised some of those companies in the past. I don't anymore, but I have in the past. So bear that in mind, everyone, but I'm not getting paid by them anymore. So, but I think they're pretty good. I think they're pretty good because the lab test itself is highly variable, and it can vary from operator to operator. It can vary from lab to lab. And we've kind of got to the stage now where some of the mobile phone technology is within that kind of noise level. I don't have a lot of experience with home sperm testing where you send it away to a lab. I would worry then about how long it takes to get to the lab and whether you would get an accurate motility measurement. Having said that, this is commonplace in the United States for example, men who have cancer and they want to bank sperm and they live some distance from a sperm bank. So maybe some of the kind of buffer solutions that they provide are able to preserve the motility in a way that I'm not aware of. I don't think any home sperm test is a complete substitute for going to a properly accredited lab. But if it helps you get used to it, and if it helps you kind of engage with it, I kind of think these tests have a place. So, you know, if you're working yourself up to going into a lab, I know it's embarrassing. I know, you know, if you've got to produce a sample on site, it's not the nicest thing in the world. If you want to do your first test at home and you've got the resources to pay for a test like that, go for it, in my view. Just be aware of the fact that you will be asked at some point to do an official one in an accredited lab.
Yeah, that's I think that's really great advice, really, because it is daunting, and at the very least, if you get used to using the cup, etc., and getting used to aiming and stuff.
I think the thing to think about though is how would you react if you got a negative result or if you got a poor result?
Yeah.
And I think that's really important. So, you know, if you come in from the pub and it's 1 o'clock in the morning and you think it's a good idea to do this test and you might be upset by the results, then perhaps that's the wrong time to do it. You need to think about who's around you. Is there access to a phone line where you could phone in for help? So on and so forth. So, you know, just be aware of those things before you do the home test.
Yes, absolutely. I know of at least one that offers kind of the post-test kind of wraparound support, and another one that we've partnered with for the emotional side of support. If anyone does face an adverse result, just to come here at Nexus and find people who have been in that situation and know. And obviously, this is why we put on things with you, because we always stay in our lane. We'll never advise on anything clinically, medically, or anything like that. But we know what it's like when you get those told those results and how hard that can hit. But also, it's important to know that, like you said, it won't replace clinical grade testing at this stage. But you're still best to go in and get it checked, and then also just be a bit more aware of, like you said, when you did it, and then that you'll always be asked to take a second test anyway for verification.
Yeah.
Excellent. So now coming on to the future of fertility, there was a recent article which I know you made comment on. It was about lab-grown sperm, and this is something that came up in one of our support groups, actually. So what is that, and how far away are we from that, from being kind of a mainstream practice?
Yeah, so I mean, this is really the realm of cutting edge science. I mean, I was going to say it's the realm of science fiction, but actually it's closer to reality than I think many people think. So I'm doing it a disservice calling it science fiction. There are a number of groups around the world trying to make sperm in the lab for men who don't have any, men who are azoospermic or men who went through childhood cancer treatment. And it has been shown to work in laboratory animals. So in mice, you could take a cell, it's called a stem cell, you could take it from the bone marrow, you could take it from the cheek, the inside of the cheek, or you could take it from another part of the body. And through a variety of kind of techniques in the lab, you can coax this cell, or these cells, because there's usually more than one, to develop into a fully functional sperm. I think you still have to use ICSI to inseminate the egg with it, but it's, you know, it's got the right number of chromosomes, it's gone through enough of the changes that we see in sperm for it to be a viable sperm. And we know that it works because the mouse pups that were born are healthy and there's nothing wrong with them. So we know, we've got proof of principle. Now, doing it in humans is a challenge. We need to be kind of even more on it with the safety testing. There are a number of people out there who are trying to do that. People ask me how long I think it will take, and I don't know. I keep saying 5 to 10 years, and then kind of time moves on. But I think it's closer than people will realise. And there was that recent report in the newspaper from a conference presentation at the ESHRE meeting in Paris that said that there's a group in Japan that are getting fairly close now. And it's not just sperm, they're also looking at making eggs for women too. The thing about this at the moment is in the United Kingdom, it would be against the law to use lab-made sperm or eggs, and it would take an act of Parliament to change the law to allow that to happen. Now, that was last debated in 2008, and the parliamentarians thought that that was a step too far. But since then, we've had news about the mitochondrial donation babies, which are equally controversial, if you like. 10 years ago, we had that debated in Parliament. They passed the law. Experiments has happened over the last 10 years, and now we know that there are 8 babies born through that technique. And so I think something similar will need to happen. There'll need to be lobbying of the parliamentarians to consider changing the law, parliamentary time to debate the law change, and then the science will follow. So that's where patient power is important, because it was the view of the patients who had mitochondrial disease in their families that got the law changed. And I would say the views of men and couples who want to see a law change, we need to hear those voices to get the parliamentarians to take this seriously and consider a law change.
That is so interesting. It must be really exciting to be in a lab when something that you've fathomed from your mind, an idea, to think, can we make this work, and then to see it work. And like you said, there's mice cubs being born and then healthy as well. It must be so exciting.
Now, there's a caveat to this. There's a really important caveat that we should perhaps talk about is on the internet, there have been companies claiming to be able to do this for you. If you send in a sample of your stem cells, it's usually a cheek swab, you do that and you can send it in. Please be aware that this has not yet been scientifically proven. My suspicion is that some of these, if not all of these companies, are just trying to get money and they're not really doing it for you. So do not send $20,000 to companies on the internet to make sperm for you. It hasn't yet happened in humans as far as we're aware. Please do wait and don't fall for that trap, because there's a lot of inscrutable people around that want fraudulent reasons.
That's really preying on very vulnerable people who are
exactly
in a state of stress and trauma and had their lives turned upside down from a diagnosis. That's really sad to hear. Thank you. That is exciting, and it's really interesting to follow it. Have you got 30 more years to give to see?
Well, I haven't, but I hope within my lifetime it is something that is done.
Yeah, brilliant. Is there kind of anything else that's exciting on the horizon in the labs at all?
Yeah, I mean, well, we're looking forward to a new version of the NICE guidance coming out in the UK in the next 12 months or so. Not exactly sure when, and that will, I'm sure, change some of the treatment paradigms for men and couples. There's also a renewed interest in some of the older drugs that have been around for a long time that have been used to try and boost sperm production. And so I'm currently involved with a team of across the UK from a number of different clinics, and we're just about to try a study looking at taking one of these old drugs again and just seeing whether or not it did what it said it did on the tin that people have since forgotten. So it's interesting that funders have agreed to fund that kind of research, and that gives me hope that they might be willing to fund other studies too, because what we've seen over the last 20 or 30 years is not many people have been willing to fund those kind of randomized controlled trials. And I know that some drug companies are also interested in some quite novel compounds, trying to see whether they can boost sperm production in men, which is a program of research that we've not seen before. So, watch this space over the next 5 or so years.
Yeah, I think we are in for a really exciting few years in terms of male fertility, especially the eye of Mordor has shifted and is looking firmly at men now. So yeah, let's hope that it gets the service and research that it's always deserved, of course, but it just needed that tide to turn a bit. One more thing that came up quite recently in the press was actually quite concerning to me, because I feel well and truly in this bracket. There was a study of, I believe it was in Denmark, over quite a sustained period of men with kind of subpar fertility, like poor sperm quality, etc. And it was linking that to their overall health and life expectancy. Should I panic?
Yeah, it's an interesting one, this. It's been around for a little while. That you're right, there's research been done in Denmark. The originator of this hypothesis was actually a guy from Stanford who I know quite well, and he published some of the first papers on this. And what it seems to show is that if you've got a sperm defect of some description, there's different ways to measure that, then the data across populations, that's important, across populations, would seem to suggest that your life expectancy is ever so slightly shorter. You're more at risk of cardiovascular disease, and you're more at risk of other what we call metabolic diseases, and that's kind of things like hormone disorders, diabetes, that kind of thing. The difference between a man with a normal sperm count and somebody with a sperm defect in terms of their risk of death or one of these other disorders is not massive. It's just measurable statistically across populations. So when we do a big analysis, you can see that there is a difference. Now, I can imagine that if you're a man that's had a sperm test result which isn't what you expect and what you wanted, and there's a defect there, you might be worried about your future health. At the moment, there's really nothing that we can predict or advise above and beyond trying to be healthy and taking advantage of all of the necessary things that are out there to help with your health. And I'm as bad at that as anyone else. So when I turned 50, I got an invitation to a well-man clinic. I didn't go until I was 53. And then I discovered I had diabetes, and I wished I'd gone 3 years before. So, it's not me being preachy here. I'm in it as well. But just look after your health. And if there is a screening program or a well-man service that is offered to you, or if you're worried about something, then just engage with your GP and get the necessary tests done. I think that's about the best advice that we can give it.
Yeah, I think so. That what I read into that, because as always, the headlines are quite alarming. And then I read into it, and my kind of takeaway was, if you just live a healthy-ish, balanced lifestyle, you should be okay. It's not that you're not talking a huge stretch of years here difference. It's it's one of those things. I think usually for men, our biggest marker around our overall health is, as you touched upon, our reluctance to go to the doctors when something's up, and we just ignore it. And that usually for us is a bigger problem in general.
Yeah. And I think the other thing is, if you kind of fixate too much on this, then you may have a life where you're worried and stressed about it. And I don't think that's healthy either. So I think it's nice to try to get it in proportion. You're
right. Yeah. And then there was this wasn't part of this, but I remember seeing another news release recently where it was talked about the increased cortisol in our body from our modern lifestyles of stress-induced lifestyles and work, but then the effect that has on your fertility, and then we go around in those circles again. So just be more zen and more balanced.
Try and be healthy.
Yeah. That's the thing. Yeah, I think anyone who is on par all the time, I'd take my hats off to you, because I don't know anyone personally who is, but it's all about moderation. That's brilliant, Alan. Thank you very much. And that wraps up kind of what we had planned for the webinar. Now, I've been monitoring the chat. There's no live questions have come in, but there are a few pre-submitted ones, so I'll just come on to some of those. Can general illnesses affect semen analysis results, and should I delay an examination if I've been ill lately?
Yeah, they can. It depends on the type and severity of the illness. A little 2-day snuffle probably isn't going to have much of a problem, but if you have proper influenza, for example, and what I mean by proper influenza is not man flu. I mean it's in bed and sweating for a week or so. We can detect that in a semen analysis result, usually 2-3 months later, because of the length of time that it takes to produce sperm. So would I delay having a semen analysis because of that? I probably wouldn't. And I wouldn't for this reason, in that if the semen analysis is normal, then you've done it and you're on your way. If it's abnormal, then the protocol would normally be to repeat that. And you will be called back. So I just think that delaying it could start a cycle of almost delaying it inevitably, because we're all ill from time to time, and how ill do you have to be before you delay it a second time? So I would say, if you're well enough to go to the lab, to the clinic, do your test, because if it's normal, you won't have to do it again.
Great advice, thank you. Someone said that they've been told they've got grade 3 varicocele. Should they always be addressed in cases of subfertility?
Yeah, so a varicocele, for those that don't know, is an expansion of the veins in the testis, usually on the left-hand side, and it kind of takes on the appearance of a little kind of bag of worms, they call it. It's like lots of expanded tubes on the left-hand side. It can cause pain. There are different grades of varicocele. You could have a subclinical varicocele, you could have a 1, a 2, or a 3. If you've got a grade 3 varicocele, it probably will be giving you a bit of pain now and again. It's an ache in the testis. And for that reason, that would be my number one reason for wanting to have it looked at, because I would want the pain to be managed in some way. Now, should you have it operated on for fertility reasons has been controversial for a long time, but there's now fairly good evidence that if you have subfertility, if you have a poor sperm count and you have a varicocele like this and you have it operated on, that the pregnancy rates are higher than if you didn't. Unfortunately, many of these studies didn't actually say whether more babies were born. We kind of would assume that they are if the pregnancy rates are higher, but that wasn't measured. It takes a lot of time to measure that. And so the current thinking is it's probably worthwhile having the varicocele operated on, as long as your partner has good fertility. And that is a discussion to have with the gynecologist or the urologist. If your partner's got a fertility issue as well, then there's going to be a discussion about the relative balance of operating versus not.
Sure, that's great advice. And I remember that ache well, actually, before I even knew what I had, like kind of more so when I go out on runs and just feeling it on that left side, and sometimes right up into the kind of abdomen area as well.
Yeah, and it's a funny quirk of anatomy, the fact you get them on the left and not the right. It's just the fact that our left and right sides of our body are not the same, and it just so happens that the veins are on the left side.
Yeah. Yeah, it's not comfortable. So I think, generally, if you hear something like this and you think, oh, I've got that, definitely worth getting checked out.
Yeah.
So someone said, with borderline semen analysis results, what are the most impactful lifestyle changes to make now, and should I take fertility supplements?
Yeah, it's an interesting one. The biggest, well, it depends what the defect is, really. The biggest impact with regard to a low sperm count is actually abstinence, believe it or not. And so waiting for longer until you next ejaculate probably will boost your sperm count far more than any lifestyle intervention. But the problem with that is that the sperm that you ejaculate will be older, and so they won't work as well because of that reason. So there's a real balance to strike. If it's a motility problem, then I think there are very few things out there that will make a difference that I'm aware of. And if it's a morphology problem, then I don't really think that lifestyle has much of an impact on that. So I would say, the biggest things to worry about are things like overheating your testicles, so wearing loose pants rather than tight pants. Not smoking is important advice. Drinking is something that you can do in moderation in my book. A glass of wine or a drink of beer with your dinner isn't going to affect things too much. There's no reason to stop. But equally, don't go out on a Friday night and have 12 pints, because that's not good. So they're probably the major lifestyle things that I would think of. Now, the supplements question is an interesting one that I get asked all the time. There are mixed reports about the effect of supplements. The bigger studies have now tended to show that there really isn't much benefit in taking the supplements, and you will spend an awful lot of money buying supplements as well. My advice would pretty much be more about having a good healthy diet and spending the same amount of money on fresh fruit and vegetables in Waitrose or Sainsbury's or wherever you shop, rather than spending money on tablets. Now, that might be because we haven't got the right formula for tablets, we haven't got the right doses, and we haven't done the science properly. And that may well be true. The advice may change in the future, but for now, I don't think there's much evidence that taking tablets will change things drastically for you.
Sure, thank you very much. And just have one last question. I'm constantly hearing things about DNA fragmentation. Should every man in a couple struggling with fertility be tested for this?
Yeah, there's a lot out there about DNA fragmentation. It kind of makes sense that if you have sperm with fragmented DNA or broken DNA, they're going to be less successful than if you've got sperm with lots of nice intact DNA. That makes perfect sense. There is a correlation between your sperm count, if you like, and the sperm DNA fragmentation index. So the fewer sperm you have, the more fragmented they seem to be when that test is done. The issue really is, what are you going to do about fragmented DNA? There are currently no therapies out there to change it. And we have a mantra in medicine, which is, if you can't change something, why test for it? So some of these tests are really quite expensive. And therefore I worry about people that spend a lot of money on these kind of tests. Now, if you're going for IVF, what can happen in the lab is that they can use various techniques to select the best sperm with the most intact DNA, and there are a number of techniques around there. Simple sperm washing, microfluidics, for example. There are a number of different ways to tackle this. Those things will be done anyway, regardless of whether you get a sperm DNA fragmentation test done. So in my book, I'm not a great supporter. I know there are people that disagree with me, and again, perhaps this is one of these areas where we don't have complete consensus on the topic, but I think it's telling that very few professional bodies in the world, and no clinical guidelines that I'm aware of, actually do support DNA damage testing.
Sure. Yeah, it's interesting to know that it is going to happen anyway in the lab, and the best selection will be made. I guess for certainly in ICSI. Yeah, it's really interesting. Thank you. Yeah, so Alan, that was amazing. Thank you so much. Literally, like I said at the outset, I couldn't think of anyone better to tackle some of those topics, and really appreciate your time, but also your expertise here this evening. Thanks for coming.
It's been an absolute pleasure. Thank you, and thank you for inviting me and setting up this wonderful platform. Now I'm logged in, I can have a look and see what goes on.
We got you now.
Yeah,
you're in. But always welcome. Thank you so much, and yeah, we'll catch up soon. Thanks, Alan. Goodbye.
Goodbye.